Hi guys, how you doing? My name is Remi Sovran, and for those of you that watched my last video, you would know that I specifically talked about lower back pain and lower back disorders. And now today, I want to talk about spinal traction. Now spinal traction is specifically beneficial to someone that would suffer from a disc bulge, and the most common types of disc bulges that I have seen are L4, L5, and L5S1. And now spinal traction itself, the whole point of it is that it's expanding your spine and it creates more space for the disc to go back into place when it has bulged out. So here we have a little diagram of our spine, and we have our sciatic nerves here, which is a common symptom of a disc bulge. So we have our vertebral bodies and our facet joints, here the black lines you see, and then in between each one we have a vertebral disc, which are the little blue circles that you see. So what ends up happening with a disc bulge, as we see, for example, we'll just say this disc starts bulging. So it's going to come out of place for a posterior disc bulge. It will posteriorly bulge out, and this sciatic nerve here that's running, it's going to basically hit the nerve, whether it's the left or right side, so it could also bulge posteriorly. So in my case, it was bulging laterally to the right and posteriorly, and it was hitting this right sciatic nerve, and I was getting pain going down my leg. So with spinal traction, what ends up happening is that over time, how gravity works is that we keep creating a force as we walk, and everything gets compressed. So all these discs here are going to get compressed over time. So the space is going to decrease in between each one. They're going to get sandwiched together almost. That's just how gravity works over time, and this ends up leading to us becoming slightly shorter, and we lose some of our original height. So now, when we engage in spinal traction, everything's going to open up, and we're going to create space for the disc to go back into place, and eventually it'll restore our original height, but it's only a temporary fix. So now, 3 different methods of spinal traction that an individual can engage in would be: firstly, they could use an inversion table. And now for an inversion table, this creates a large amount of traction. I think it actually creates the most. It just involves you hanging upside down. Now at the same time, not everyone has the money to spend on an inversion table. So there could be other additional methods that individuals may want to use. A second method would be an individual could hang from a chin-up bar or some sort of bar where their feet are not touching the ground. And when they're hanging from the bar, they don't want to swing, they want to keep their core strong, feet off the ground. And this is going to create traction, and it's going to allow for more space to be created, and therefore the disc has more room to go back into place because the spine is not so compressed. And then a third method and final method would be just physical manipulation, having someone like a physical therapist physically manipulating an individual. And how this would work would be an individual with a disc bulge would basically lie on a table or lie on the ground, and they would maybe slightly grip the sides of the table just to hold them in place, while the other individual would grab their feet and slightly pull and hold that position for a few minutes. And this is going to create traction as well. However, from experience, it's not as great as hanging from like a chin-up bar or an inversion table. Now, you may say that it's only going to be temporarily, because once that individual now gets up and they start walking around again, everything's going to compress and it's going to basically return to the size it was already at, and they're going to basically shrink in height slightly. It's not a big difference, but it's a slight difference. Now this is true, but what individuals want to do with a disc bulge is, after they've engaged in a spinal traction, whether it's an inversion table, physical manipulation, or just hanging from like a bar or chin-up bar, is that they want to lie on the ground. Now this is what I did when I had my disc bulge, was I just lied on the ground with my stomach facing the ground. So I'd lie specifically right on my stomach, and how that would work is that now that you have created the space from the spinal traction, everything's open. And so now, since you haven't walked around and created any compression, you specifically lie right on the floor on your stomach, gravity is now going to pull the disc anteriorly forward back into place. And so you have all that room that you've created from the traction disc will be pulled forward, and this will start to begin the healing process of your disc bulge. Now, it's not going to happen immediately, it's not going to happen right away, it's going to take some time, and you have to be patient with that. But this is one of the best things that an individual could do. Now, there's one thing to keep in mind. You may think that lying on the ground, lying on your stomach is uncomfortable, and it's not good posture. Now, this is true, so one thing you could do is place a pillow or two under your hips. So by placing these pillows under your hips, it's going to keep you in a more neutral and comfortable position. And it's going to prevent the facet joints, which are these black lines here, from rubbing against each other when you're in that extended posture. Now, it's also important to keep in mind that when you're in that position, it's not always good for your neck. It could place some strain on your neck. So therefore, you might want to move around every 30 minutes or 45 minutes just to loosen up and stretch, and you can go back in that position. Now, this is how I spend most of my days, just lying on the ground. That's how I'd watch TV like that. I would work on my laptop, just lying on the ground, and basically my disc would be healing because it would be moving forward as I create that space. And so I have an inversion table myself, so I basically use that inversion table a couple times per day, and then I just go, after I use it, go lie on the ground, and then get up, move around, and then use it again, and lie back down on the ground. So this is specifically the method I use to heal my disc bulge, and it has worked significantly. My disc is a lot better right now, so I'm at the point where things are a lot better. So that's just one thing to keep in mind, and it's something worth a try for you guys. So without further ado, I hope you guys enjoyed this video, and if you haven't already, check out my previous video where I talked about lower back pain and lower back disorders and my story that I shared, and my top 5 recommendations as well. Okay guys, I hope you guys learned something from this, and if you have any questions regarding spinal traction, just leave a comment below and I'll be happy to answer it. Thanks guys, take care.